Hi, I'm Dr. Rob Malizia. I'm an emergency physician and one of the providers on the Northwell Health GoHealth Urgent Care team. I'm here to talk to you today about a question that I field very commonly in the clinic, and that is, Doctor, how can I avoid getting hurt like this in the future? Over 7 million Americans every year seek some sort of medical treatment for either athletic or fitness-related injuries. There are certainly traumatic, unexpected injuries that we can't really prevent, but the vast majority of these injuries are due to three common causes: overtraining, undertraining or lack of conditioning, and improper training or selection of the improper sport for your body. There's a few really common things that we can do to help prevent these injuries, and whether you're an amateur or professional athlete, a weekend warrior or a former athlete, or somebody who's engaging in sports for the first time, that we can do to help you stay healthy. First of all, and something that we commonly hear and commonly ignore, is get a physical. It's really important that you're evaluated by a physician for any kind of underlying medical problems that can contribute to illness or injury during sport, including heart, kidney, musculoskeletal, just to name a few. Secondly, consult with a physician, a professional trainer, or a coach regarding sports that are right for you, pros and cons of any sport you're thinking about participating in, and to help you put together a training regimen that can safely get you prepared for your goals. Wearing protective equipment. We all know sports apparel can be really expensive. There's many different brands out there. It's hard to know what to choose from. But working with a sales consultant at a specialized sporting goods store or specialized store can help you choose the right equipment for you and hopefully offer you some different price points that work within your budget. This includes everything from footwear for runners and other types of athletic training, to protective gear, padding, mouthpieces, helmets, which are so important. And it's important that they have not only the right makeup for you, but the right fit so that they are protecting you. Fourthly, working on your flexibility and proper warm-ups prior to exercising is so important, and it's something that we really don't often allot time for in our busy schedules. I want to introduce you to Stephanie, who's another part of our GoHealth team. She's one of our resident jocks here. Stephanie is actively involved in a training regimen right now, and she's going to demonstrate a few of the things that I'm going to be talking about here. Thanks, Steph. Appreciate it. So, firstly, you want to get a good warm-up prior to stretching and prior to exercising. That can involve, an exercise bike, jumping rope, going for a run, just anything to get your body temperature up and get you sweating. And then from there, prior to activity, engaging in dynamic stretching, which is active movement. Stephanie's going to show you what a dynamic shoulder stretch might look like. And now maybe of the wrists. And show me a dynamic stretch of the wrists. And then, thank you, Steph. And then following exercise is when you want to do what we traditionally think of as static stretching. And Steph's going to show us a static stretch of the shoulder and a static stretch of the wrist. So these are where you hold them for a prolonged period. And this can really aid in increasing your flexibility following a workout. The next thing is you want to make sure you're always using proper technique. And this ties back into working with a professional to develop a workout routine. You want to know how to do the exercises that you're going to be doing and how to do them properly. That's so important because subtle differences in your technique can really contribute to injury. I'm going to have Stephanie show me an exercise here. This is really core to many sports, and we all know the squat. Squatting is a crucial exercise, but one that, if done improperly, can really lead to a lot of injuries, and this is not an uncommon problem. So Stephanie, I'm going to have you demonstrate a proper squat. Notice how Stephanie dips down with her back nice and straight, with her knees behind the front toes, and then she's going to come back up. Now, just a slight bend in the back, if you go ahead, which is not uncommon when people have bars on their back with lots of weight, can contribute tremendous forces to the low back, which can contribute to injury. So that's just one example of countless examples of things that you can do improperly that can really increase your risk of injury rather than prevent them. Next, I'd like to talk about staying active, right? So for competitive athletes, we all have some off season, and it's not uncommon for people to be very inactive in their off season. For those of us who are former athletes, we have sometimes very long periods of inactivity. And for those of us who have never been involved in sport, there's really never been any physical activity. So regardless of your level of activity or competitiveness, there is some downtime, and it's really important that if it's downtime between seasons, that you're staying active, doing some things to maintain your fitness, flexibility, and strength. If you've been out of the game or have never been in the game for long periods of time, you really want to work with a coach or a trainer to help ease into a competitive routine. Next, during your exercise sessions, staying properly hydrated is really important to avoid fatigue, muscle cramping, and subsequent injuries, as well as medical problems such as kidney trauma and rhabdomyolysis and other complicated conditions. Taking periodic breaks during your practice sessions, as well as interval rest periods. If you're a very competitive athlete, you still got to make sure you take a day or two off during the week to recover. That's really, really important. But also intermittent breaks during a workout so that you can regroup, maintain your form, and really try to avoid injury. And lastly, making sure that you stop what you're doing if you feel pain. If you injure yourself during an activity, stop where you're at, reassess the situation. If it continues, you really need to get into a medical professional, get it evaluated, because the worst thing you can do is try to play through an injury. It will only worsen it. So I hope these points have been helpful. I wish I listened to my own advice. I recently threw my back out, and that's why I'm sitting, which is also probably bad for my back. Good luck, happy, healthy working out, and stay healthy.